Welcome back to Great Day. Heart disease and lung cancer kill more Texans than all other diseases combined. In most cases, there are no symptoms, and when it's diagnosed in later stages, it's much harder to treat. Advanced body scan can actually look inside your body from head to toe to find problems in the early stages, and that could save your life. Joining us with how it works is radiologist Dr. Anthony Sparks. Good morning, Dr. Sparks.
Good morning.
All right. We mentioned how lung disease, heart disease, some of the top killers among men and women actually around the world, they don't have to be if we simply had early intervention. The problem is oftentimes those symptoms don't present themselves until much later, if at all.
Correct. Yeah, unfortunately, a lot of times the first, sign or symptom of heart disease is a heart attack. And obviously that can be a really bad and difficult situation to deal with. So our goal with advanced body scan is to try to help people find signs of illnesses long before those illnesses have reached a point where they're in a serious condition. And then we can catch those things early and treat you early before you progress to something significant like a heart attack.
Yeah. Okay. People will say, well, I went and got my physical, and I've been to physicals before where they said, well, how are you feeling? They take my blood pressure and that's it. That's just a little bitty part of the story.
Right. As physicians, we have a lot of different tools in our toolbox, and a history and a physical is obviously very important, as well as lab work and a lot of other things. And so what we offer with these CT scans is just another tool in that big toolbox. Looks at a completely different portion of your health history and what's going on in your body in a completely different way. So it adds a lot of information in addition to that traditional physical that you mentioned.
Yeah, because if you say, oh, I feel fine, it's all good, that's because you don't really feel a small cancerous growth, for example.
Correct. Absolutely. Yeah. So we're, the heart and lung scan that we're talking about today, we're looking at a calcium score that's a measure of your future heart attack risk. And they're also looking at small things in your lungs. So small nodules that could potentially be a cancer. And these things may be, 4 or 5 millimeters in size when we see them initially. And they can be very easy to deal with at that point before they progress to being much larger and actually causing those symptoms. And so again, catching something early is always better than catching it when it's, possibly too late.
Yeah. Okay. We're seeing people in this scan right now. I've heard people say, oh, I don't like those scans. I feel so claustrophobic. This is more like a donut. So you're never really closed in, and it literally takes just a few seconds for each scan.
Right. Yeah. So this technology that's available now is very easy. I mean, you come in as you are. There's no prep involved. There's no needles. You're not injecting anything into you. Nothing touches you. You're in and out of that machine very quickly. Each scan, like you said, only takes a matter of a few seconds. You go home, and again, there's no drugs or after effect. Claustrophobia really is not an issue with these at all as well. So it's very simple to do, which is also a great, benefit of this exam.
Yeah, I didn't go home. I went shopping, Dr. Sparks. But anyway, and then what happens is you as a radiologist, you look at all these scans and you can figure out if there's something going on in someone's body. And then you send people a report. I got mine. So thank you. And so and it's very easy to understand, and it just gives me peace of mind. Now, I know there are some people who say, oh, I just don't want to know. I don't want to know. You want to know. You have patients who had no idea, and because they got this scan, they are alive today.
Right. I mean, really on a daily basis, we find people with really elevated calcium scores that need to see a cardiologist. On a weekly basis, probably we find people with other serious issues and findings concerning for cancer, aortic aneurysms, lots of other things that need to be dealt with. And so it's really, honestly, I was surprised when I started, doing this several years ago about how often we really do find things in people that are significant and they're walking around with no symptoms at all. So it's really quite amazing.
When you find something significant, you try to let people know as soon as you can.
Right. Yeah. So we have a team of medical professionals as well that work along with me, and we contact people by phone whenever we find something significant. We help you get the further care that you need, whether it's a cardiologist or somebody else. We want you to take this information to your family doctor as well, even if we don't find anything significant, and discuss that with them. Because again, we want people to be empowered to take control of their own health, and having this extra piece of information can definitely go a long way in that.
Yeah, and it's a kind of a change of thought, because so many of us, again, as I mentioned earlier, we go to the doctor when something is wrong. If you're going to be a partner in our health, preventive medicine, we have the technology to fix a lot of things, but if it's too late, it's hard to do. So we have to be a partner in our own health and get in early.
Yes, absolutely. We completely agree. And that's really our whole thought process behind this, is to get people to take charge of their own health. And we want people to do exactly that, and we just want to help you in that journey, in that process.
Yeah.